A staggering 85% of seniors have no idea that new laws in 2025 could put thousands back in their pockets. Think about it. A new $6,000 tax deduction, plus the power to stop the government from taxing your Social Security. And these are just two of the 11 hidden changes we're uncovering to help you thrive, not just survive in your golden years. Number 1. The elimination of federal income taxes on Social Security benefits. What if we told you that for decades, the government has been dipping into your Social Security checks like an invisible thief, taxing benefits that you already paid into during your working years? Under the new legislation embedded in the One Big Beautiful Bill passed earlier this year, most beneficiaries no longer pay federal taxes on their Social Security income, delivering immediate and profound tax relief. This isn't some minor tweak, it's a game changer that uncovers a long-hidden tax burden eroding retirees' earnings, shocking millions who assumed their benefits were untouchable. Picture this: a widow in Ohio, living on a fixed $1-800 monthly Social Security payment, suddenly realizes she's been handing over 15% to Uncle Sam each year, amounting to over $3,000 lost annually. That's groceries, utilities, or even a modest holiday gathering with grandkids gone. But now, with this reform, nearly 90% of recipients see zero federal tax on their benefits, boosting net income by up to 22% depending on your bracket. It's incredibly useful for older Americans, helping cover skyrocketing living costs like healthcare or housing without forcing you to raid savings or downsize your dreams. The shock factor? Data from the Social Security Administration reveals that before this law, over 50% of seniors paid taxes on benefits, often without realizing how thresholds crept up on combined income from pensions or part-time work. One study shows this silent tax hit low to middle income elders hardest, pushing 1 in 5 closer to poverty lines. Now, the curtain is pulled back, empowering you to reclaim financial freedom in your golden years. So what should you do? Check your latest SSA statement online at SSA.gov and consult a tax advisor to verify your eligibility, especially if your combined income hovers around $25,000 for singles or $32,000 for couples, the old triggers that no longer apply for most. If you're among the high earners still taxed, explore Roth conversions or charitable donations to minimize hits. This law isn't just relief. It's a revelation of how the system quietly disadvantaged seniors for years. Ignoring it could mean leaving thousands on the table. Don't let that be your story. Number 2, the $6,000 bonus tax deduction for taxpayers age 65 and up. Imagine discovering a hidden perk tucked into massive tax reform that hands you an extra $6,000 off your taxable income, but only if you're savvy enough to claim it, while millions overlook it entirely. Introduced in the One Big Beautiful Bill, this additional deduction for seniors is effective for tax years 2025 through 2028, stacking on top of your standard deduction and phasing out for higher incomes. It's shocking because it reveals how the old system shortchanged elders, with buried fine print in prior codes that favored younger workers or the ultra-wealthy. Take a retired couple in Florida. They filed jointly, pulling in modest pensions and investments. Without this, their tax bill eats into $4,000 yearly. Now, this bonus slashes it by hundreds or even thousands, depending on brackets, potentially refunding enough for a new hearing aid or a family cruise. Useful? Absolutely. It reduces taxable income, easing the squeeze from inflation on fixed budgets, especially for those with pensions or IRAs. Stats from the IRS show seniors overpay by an average of $1,200 annually due to overlooked deductions, and this one targets that gap head on. The outrage builds when you learn that before 2025, similar perks were temporary or income capped so tightly that only 30% qualified, leaving vulnerable elders exposed to higher effective rates. Real stories abound. A veteran in Texas, battling medical bills, used this deduction to offset costs, avoiding debt. It's a breakthrough against the hidden dangers of tax complexity that trap older Americans in cycles of financial stress. To leverage it, gather your 1099 forms early, use free IRS tools like the Interactive Tax Assistant, and meet with a certified elder law attorney or CPA familiar with 2025 updates. Phase-outs start at $75,000 for singles, so plan withdrawals strategically. This isn't just a deduction, it's exposure of systemic injustices, turning the tide for empowered retirees. Number 3, the Social Security Cost of Living Adjustment, COLA, of 2.5%. What if your raise from the government barely covers a tank of gas, while inflation ravages your grocery bill, exposing the brutal reality that official adjustments often lag behind real-world hardships? Starting January 2025, benefits rise by 2.5%, bumping the average monthly check to about $1,276 for over 72 million recipients. This ranks high in our list for its raw shock value. It unmasks how small COLAs fail to match surging costs in essentials like food, up 4% last year, or healthcare, averaging $12,000 annually for seniors. Envision a grandmother in rural Kansas, her $900 check stretched thin. This bump adds roughly $50 monthly, helpful, but swallowed by a single doctor's visit. It's highly useful for offsetting inflation, providing a buffer against poverty for 1 in 4 elders who rely solely on Social Security. Yet, the hidden truth evokes outrage. Government formulas use a general CPI, ignoring senior-specific spikes in meds or utilities, leading to a cumulative 20% loss in purchasing power since 2000 per advocacy groups. Stories of seniors skipping meals or meds to make ends meet highlight the empathy-stirring injustice. This adjustment, while automatic, demands awareness. Many don't track it, missing opportunities to budget or supplement with programs like SNAP. To maximize, log into your My Social Security account, project your new amount, and pair it with low-income energy assistance if heating costs bite. It's a call to awareness. Don't assume it's enough. Advocate for better indexing through AARP petitions. This law peels back the curtain on overlooked economic horrors facing aging Americans, urging proactive steps for true security. Number 4, the Social Security Fairness Act ending the Windfall Elimination Provision, WEP, and Government Pension Offset, GPO. Picture a firefighter whose battle blazes for 30 years, earning a modest public pension only to see his Social Security slashed by up to 50% upon retirement. A shocking gotcha clause buried in the law since the 1980s, affecting over 3 million Americans and evoking raw outrage over broken promises to our everyday heroes. Signed into law on January 5, 2025, this act eliminates these reductions for those with public sector pensions, restoring full benefits and back payments totaling billions. It's profoundly useful for millions of teachers, police officers, and civil servants, potentially boosting monthly checks by hundreds, enough to cover rent hikes or medical co-pays, transforming precarious retirements into stable ones. The shock factor explodes from exposing this decades-old injustice. Data shows WEP alone clawed back an average $300 monthly from affected seniors, pushing many into part-time work or food banks, with stories of widows losing spousal benefits entirely under GPO, leaving them in poverty despite lifetimes of contribution. One retired nurse in California shared how the offset erased half her survivor benefits after her husband's death, forcing her to sell her home, a heart-wrenching tale of systemic betrayal. Now, with the act in force, Adjustments began in February, and by July, over 3.1 million received lump sum payments up to $17 billion collectively, an awe-inspiring turnaround. This uncovers the harsh reality of how laws favored private sector workers while punishing public ones, a cultural taboo of inequality that's finally shattered. To claim your due, log into your My Social Security account at SSA. Gov to check for automatic adjustments. If you're affected, expect retroactive payments if eligible since 2024. Consult a financial planner specializing in public pensions to recalculate your budget. Many are seeing 40 to 50% increases. Don't wait. Errors in records could delay your windfall. This law isn't just reform, it's restitution, peeling back layers of overlooked exploitation and empowering elders to live with the security they deserve. Number 5. The Medicare Part D out-of-pocket cap at $2,000. What if the pills keeping your heart beating or your pain at bay suddenly cost you $10,000 a year, driving you to ration doses or skip refills? A terrifying hidden danger in America's healthcare maze that's bankrupted families and shortened lives? Starting in 2025, under the ongoing reforms of the Inflation Reduction Act, prescription drug costs in Part D are capped at $2,000 annually, a ceiling that halts catastrophic spending for over 60 million enrollees. Enormously useful for seniors with chronic conditions like diabetes or cancer. This prevents out-of-pocket spirals that previously averaged $5,000 plus for high-need patients, freeing up funds for essentials like housing or nutrition. The shock value lies in unveiling Big Pharma's profiteering. Before this, 1 in 4 older Americans skipped meds due to costs, with AARP stats showing women and low-income groups hit hardest, leading to hospitalizations costing the system billions more. Imagine a grandfather in Texas battling arthritis who halved his doses to stretch his budget, only to end up in the ER, a story repeated in investigative reports that build tension around profit-driven neglect. This cap, phased in from prior year's negotiations, lowering prices on 10 key drugs, now blankets all Part D plans, including Advantage options. It's a breakthrough against the environmental horrors of unaffordable care, where hidden markups inflated bills 300% above production costs. To utilize it, review your plan during open enrollment, ending December 7th. Switch to one with better formularies if needed, and track expenses via your Medicare account. If you hit the cap early, no insurers can't charge more. Appeal any denial swiftly. This exposes societal injustices, evoking empathy for those quietly suffering, and calls for awareness to maximize savings. Number 6. The Medicare Prescription Payment Plan. Envision facing a $500 drug bill in January that wipes out your monthly budget, forcing choices between medicine and meals. A cash flow crisis that's plagued fixed-income elders, hidden in the bureaucracy of seasonal health needs. New in 2025, this voluntary option lets you spread Part D out-of-pocket costs over the year in predictable monthly payments, smoothing the financial roller coaster. It's incredibly useful for budgeting stability, especially with the $2,000 cap, allowing even distribution without interest or fees, ideal for those with high winter costs from flu seasons or allergies. The appeal comes from revealing this overlooked flaw. Surveys show 40% of seniors delay fills due to upfront hits, worsening conditions, and spiking ER visits by 20%. A real-world anecdote. An Arizona widow with COPD racked up $1,200 in spring bills, leading to debt. Now, monthly caps at $167 ease the strain. This plan, opt-in via your insurer, integrates with the cap for seamless relief, uncovering how prior systems favored the healthy while punishing the vulnerable. Enroll by contacting your plan provider before your next fill. It's free, and you can opt out anytime. Track via app or statements to avoid surprises. This pulls back the curtain on daily living dangers, fostering outrage over preventable hardships. Number 7. The increase in Medicare Part B premium to $185. What if a small $10 hike in your monthly premium quietly erodes your nest egg, compounding with deductibles to devour hundreds annually? A creeping cost that's outpaced wages and COLAs, shocking in its subtlety amid broader reforms? In 2025, Part B premiums rise by $10.30 to $185 monthly, with the annual deductible jumping to $257 from $240, affecting doctor visits, outpatient care, and preventive services. Useful to know for budgeting, as it hits over $60 million, with income-based surcharges kicking in above $103,000 for singles. Plan ahead to avoid bracket creeps from pensions. The shock? CMS data reveals premiums have doubled since 2000, while senior incomes lag, pushing 15% into medical debt traps, with stories of retirees forgoing checkups, leading to costly emergencies. A Michigan veteran saw his premium eat into his COLA raise entirely, highlighting the outrage of premium creep in a system meant to protect. Pair with Medigap for coverage, or explore low-income subsidies via Medicare savings programs. This exposes hidden economic horrors, urging reflective action to secure affordability. Number 8. The increase in Social Security taxable earnings limit to $176,100. What if the ultra-wealthy max out their Social Security taxes by February, while everyday workers grind through December, a shocking disparity that's widened the gap between the haves and have-nots, fueling a system on the brink? In 2025, the wage base for payroll taxes rises by $7,500 from last year's $168,600 to $176,100, meaning higher earners pay on more income, but only up to that cap, bolstering the fund's solvency. Useful for pre-retirees still working, as it could translate to higher future benefits by crediting more earnings, potentially adding $100 to $200 monthly in retirement for those near the cap. The appeal shines in uncovering this baked-in favoritism. SSA data reveals just 6% of workers hit the max, yet they contribute disproportionately less relative to income, leaving the program projected to deplete reserves by 2035 without reforms. Picture a corporate executive in New York earning $500,000. Their Social Security tax ends at $176,100, while a nurse pulling $80,000 pays on every dollar. A tale of social injustice that evokes outrage, with advocacy groups noting this cap exacerbates elder poverty rates at 10%. Real stories amplify the drama. A soon-to-retire mechanic in Ohio earning $170,000 now sees an extra $465 in taxes but gains benefit credits, a double-edged sword. This limit funds the trust but highlights extreme contrasts in living conditions, where low-wage seniors scrape by on $1,500 monthly. To navigate, use the SSA's earnings calculator online, adjust withholdings if self-employed, and consider Roth contributions to minimize future taxes. It's a wake-up call. Advocate for lifting the cap entirely via petitions to ensure equity for all aging Americans. Number 9. The Older Americans Act Reauthorization Act of 2025. Envision isolated seniors, cut off from meals or rides to the doctor, trapped in homes turned prisons by underfunded programs. A overlooked horror of aging alone, now spotlighted as Congress reauthorizes vital supports amid a graying population boom. Introduced in June and set for full implementation, this act reauthorizes funding through 2030 for community services like Meals on Wheels, transportation, caregiver respite, and elder abuse prevention, with enhancements for innovation and targeting underserved groups. Highly useful for accessing free or low-cost aids that combat isolation, with over 11 million served annually, including 2.4 million home-delivered meals, reducing hospital stays by 25%. The shock? NCOA reports funding hasn't kept pace, with 10,000 daily turning 65, leaving 1 in 6 seniors food insecure. Stories like a Pennsylvania widow relying on OAA rides for chemo, without which she'd face $500 monthly taxis, building empathy for hidden dangers. This reauthorization boosts flexibility for rural areas and tech integration, like virtual senior centers, unveiling cultural taboos around elder neglect. Enroll via your local area agency on aging. Find it at eldercare.acl.gov and volunteer to amplify impact. It's empowerment against environmental horrors of aging in obscurity. Number 10. The Budget Reconciliation Act of 2025 changes to Medicaid. What if political wrangling stripped away your lifeline to nursing care or home aides, imposing work mandates on the frail, a brutal reality for low-income elders where budget cuts masquerade as efficiency, threatening dignity in final years? This act, part of sweeping fiscal maneuvers, introduces work requirements for able-bodied adults, eliminates retroactive coverage, adds co-pays, and cuts federal matching rates, potentially disenrolling millions while shifting costs to states. Useful, albeit grim, for prompting alternatives like long-term care insurance or family planning, as KFF estimates 1.3 million low-income Medicare dual eligibles face higher costs. The outrage stems from exposing $911 billion in 10-year cuts, discouraging expansions and risking coverage for 20 million seniors disabled, with anecdotes of Arkansas trials showing 18,000 lost aid, evoking awe at systemic callousness. This unmasks social injustices, urging checks on eligibility via healthcare.gov and advocacy through justice in aging. It's a harsh wake-up to hidden threats. Number 11. The increased additional standard deduction for seniors. Imagine modest tweaks in the tax code handing you extra breathing room, yet buried so deep that millions miss out. A subtle win against inflation's bite, shocking in its simplicity amid complex reforms. For 2025, the extra deduction rises to $1,600 per qualifying spouse, from $550 for those 65 plus, with income limits adjusted upward, stacking with the new $6,000 bonus for broader relief. Useful for married couples, yielding $300 in savings on joint returns, easing burdens for fixed incomes. The appeal? IRS stats show seniors overlook $2 billion in deductions yearly. With this hike, part of TCJA extensions, highlighting how small changes accumulate, like a Florida couple saving $400 to offset utilities. It reveals overlooked perks, empowering savvy filers via TurboTax or AARP tools. Claim it automatically if qualifying, but verify phase-outs. And there you have it. The 11 laws every older American must know in 2025. From tax windfalls to healthcare hurdles, these aren't abstract policies. They're the unseen forces shaping your security, savings, and serenity. The good news? Knowledge arms you against surprises. Review your benefits, consult experts, and share with loved ones. Proactive steps turn threats into triumphs. Stay informed, stay empowered, and subscribe for more revelations on Shockwave World.